We are back for another Nelly skincare video. Today we are going to talk about the last facial in a box kit that we have set up for you, and that one is going to include all of the acne products that you need to be able to treat your skin and just make your skin look better sooner. So before we actually get into the actual products that we have from that kit, just to do a little kind of explanation of what acne is, why do people get it, and also what are the aggravating factors of acne. So acne is a skin condition that really occurs when you have an occlusion in your skin. So we're talking about dead skin cells. Your sebum oxidizes. Sebum is really the oil that you have on your skin. Of course, there's going to be the hormonal factors that are going to be a more internal aspect of it. There's the genetic predisposition. It has to do with your food as well for some people. So there's a multitude of different aspects that are going to affect if you have acne or not, and also how bad your acne is according to certain periods. Now, for sure, for women going through their cycle, you are definitely going to be predisposed to getting a little bit more breakouts than other people, or not than other people, but then at other periods throughout the month, for example. But acne is not something that is reserved only for women because of hormonal fluctuations. Men get it, teenagers get it, boys and girls. You're going to have it really all ages, all skin types, and doesn't have any restrictions really for who can get it and who cannot. So of course there is going to be, like I said, the genetic predisposition. If both of my parents did have acne, then there is a chance that I'm going to have some as well. As far as your hormones go, going through puberty, going through pregnancy, menopause for women, and then for men, of course, they do have fluctuations as well, which are just not as visible for them, but that is something that they're going to go through too. Then when it comes to food, somebody who eats a lot of sugar, somebody who eats a lot of fatty foods, for example, red meats, there's a bunch of different food groups that you should, sometimes they say avoid, but at the same time, you can't stop living your life either. So anything in moderation is really going to be the key to help to control everything on a more internal level. Then the last thing is really the external, based on your lifestyle habits, but also based on your hygiene, if you want to call it like that. So hygiene, not in the sense of do I shower or do I not, it's going to be really based on, yes, I shower, that's fine, but am I using hand soap on my face, or am I using an actual facial cleanser, or anything that is going to be super, super stripping? So it's always important to have products that are going to be adapted for you, and even more when we're talking about our acne skins. One of the reasons why a lot of acne cases get even more out of control is because people are using products that are so stripping, and it just kind of dries everything out. So what happens is that once you stop using them, whatever issue you had is going to come back 10 times worse. Now, those astringent products that I'm referring to is anything that's going to have too high of a concentration of a certain active. In the acne world, if you are a client who's gone to see your esthetician in the past, or dermatologist, or anybody to get skincare recommendations for acne specifically, there are always a few different ingredients that they're going to mention to you. So benzoyl peroxide, for example, salicylic acid. There's going to be, of course, the medication that you can take. I was like, what is it called? Supplements. There are supplements as well that you can take too. But as far as medication, so there's a bunch of different things, but any products that are going to be alcohol-based, we're talking about your topical products. So topical, literally they're called astringents. You put those on a cotton and then you kind of wipe your skin, and then it tingles and you feel like there's nothing left on your skin. That's because there is nothing left on your skin. That's not what we're trying to do with the Nelly products. So what I want to talk about today is kind of working on re-educating your skin, not only as far as rehydrating your skin, but also rebalancing and reconstructing your skin's natural defenses, and that is your hydrolipidic film, right? So I've spoken about this in the past. Excuse me. Your hydrolipidic film is going to be your skin's really natural defenses, and that is composed of your natural oils along with water and sweat and a few different things. Somebody with acne does have a film that is disrupted and also has an imbalance when it comes to your bacterial flora. So the key with the Nelly products is going to be to re-educate, prevent, control, and clear really all of the actual breakouts that you have. So one of the key ingredients that we're going to have in our biomedical line, of course, all of the products in here are going to be aloe juice based, so you're going to have beautiful hydration from it. But the other thing is the salicylic acid that is going to be in a very balanced formula, so you're not going to have anything that is actually going to dry you out. You're going to get all of the antibacterial or antiseptic aspects you want to have from an acne product, but without making your skin condition get worse once you stop using it. So the purpose of these products is that, yes, we're going to treat your acne now, but once your acne is gone, you don't need to stay on this forever. You can move on to something else. So you can go with a more hydrating line, or the sensitive skincare line, or even any products for scarring if that's really what you have at that point. So beginning in your facial in a box kit at home, we're going to have the Biotense. It's not Biotense. We're gonna have the BioAcne Micellar Cleanser. So just like the one in Biotense, if you've seen the video that I did last week on these products, you don't actually have to rinse this product. Now the benefit though is that, well, the benefit of not rinsing it, first of all, is that if you are somebody who does a lot of sports, you're going to the gym a lot, or just spending a lot of time outside, you're sweaty, what you want to do is that you don't want to leave that sweat on your skin for too long, because that is definitely going to be something that could increase your actual breakouts. So you can put this on a cotton, a Kleenex, whatever you have at your disposition in that moment, and then you could just wipe your skin, and that's going to remove all of the superficial debris. Now, the ideal version of using it is going to be, of course, with water, because we're trying to give you a deeper cleanse. So this is going to be anti-inflammatory. It's going to cleanse you perfectly without drying you out, because we don't have any sulfates in it. So the sulfates, remember, is what gives you that foaming agent in many other products. But it is going to dry you out if there are too many in them. So micellar foam, anti-inflammatory, going to help to rebalance your bacterial flora and give you a nice cleanse feel without making you feel like you're dry. Then we have the facial brush, which I'm very happy is in the kit, because a lot of our acne skins tend to either over exfoliate or not exfoliate at all, because they're trying to prevent spreading the bacteria, which is a good habit, or it's a good way of thinking actually, that we don't want to be spreading the bacteria. However, we still do need to get those little dead skin cells lifted off. Why? Because the more clogging, or the more occlusions I have, that's a better word, the more occlusions I have, the more I'm predisposed to getting those actual pustules and papules. We're not just talking about one breakout a month, we're talking about like a full zone that is going to be inflamed or infected, if you want to call it like that. So your facial brush, you would put your micellar cleanser on, wet your brush, soak it for a couple minutes, ideally to soften your bristles, and then you're going to gently brush to lift off the dead skin cells. Keep in mind though that we don't want to be brushing in the areas that actually have any type of inflammation, because of course you can kind of rupture the pustules and papules and then spread the bacteria. It's not what we're trying to do. We're just trying to disencrust the rest of the areas. So 2 to 3 times a week for somebody who doesn't have severe acne. For somebody whose breakout situations are more blackheads, so your comedons, that you could do once a day, pretty much 7 days a week if your skin is thick enough. Then we have our toner. So all of the toners in Nelly, they come in the spray format, as I've mentioned a few times. Now, having a balanced pH when you do have acne is more important than pretty much any other skin type, mainly because if your pH is unbalanced, you're definitely going to be more likely to get the actual breakouts, since your skin can't really defend itself, and it either is trying to overproduce the oil, or it's trying to figure out what to do. So your toner is going to be super important for the acne skins. Really, anytime that you're cleansing your skin, you should be using your toner afterwards. Now this, you can play around with it a little bit more, just like your micellar cleanser from BioAcne. Let's say you're on the road, you're doing stuff and that you want to just freshen up, you could technically use your toner on a cotton and then wipe off to remove any sweat or things like that. It is not going to replace your cleanser, but it is going to freshen you up and just help to balance things out until you're able to get a proper cleanse. So anytime you use water, you're just getting out of the shower, make sure that you just spray around a little bit, freshen your skin up, and prepare your skin for the next products. Then this is probably going to be everybody's favorite product, trying to make you see, the BioAcne Serum. BioAcne Serum is a spot treatment. So anytime you feel a breakout coming, whether it's already there or you just, I mean, we all know when a breakout is coming. I started feeling one right here, and I use my serum and it's practically gone already. So anytime you feel it coming, just take the cap off and then apply locally. What your bioacne serum is going to do is that it's going to help to kill all of the bad bacteria that actually cause the pimple to come out, but it's also going to help it heal faster. So the point is that yes, we want to dry out the area, but we don't want to make you scar, or we don't want to make you scab. We don't want to make you pick at the area that you did have the pimple, or else it's just going to create another problem. So you're going to get all of your anti-inflammatory, you're going to get your healing properties along with all of your antiseptic that you need to have to rebalance the bacteria. This, you could be using it anywhere of 2 to 3 times a day. I wouldn't recommend going above 3 times a day just because it is a very strong product, which is why you are supposed to use it only locally. If I have one pimple right here, there's no point for me to be putting it all around here, because then you could be drying out the rest of the skin. So just make sure to use it on the pimple or in this zone. So if I did have a full zone right here, I could be applying my product all over that zone, but I really would try as much as possible not to go too much over the area. Then we have the bioacne purifying gel. So your purifying gel is actually going to be your moisturizer. So anybody who does have acne, you probably think that you don't need to have a moisturizer, or you have like the two extremes. You either don't want to have a moisturizer because you feel like it's only going to make you break out, or you have dried out your skin so much with these stripping products that you're just kicking on all types of creams that really just make you break out even more because they're not going to be appropriate for your skin type. So again, by having a product that's going to be aloe juice based, you are definitely going to be getting all of your hydration, you're going to get your anti-inflammatory, but this moisturizer is also there to give you a mattifying effect along with accelerating the healing process of your skin. The thing with acne is that very often people are going to be picking. I mean, we've all done it at some point that we feel like something's coming out that we just start kind of picking, or we try to pop it ourselves. Our techniques at home are not always the best compared to what our esthetician is going to do for us. So please, as much as possible, don't pick at anything and use something that's going to help your skin to heal faster. And the other thing is that by having a matte finish, you're not going to feel like you constantly need to be using all these blotting papers and stuff like that. Your cream is going to do the job for you. So you have your salicylic acid in here as well, in a more balanced quantity, so you don't have to worry as much of sun, because the summer season or the sunny season is coming around, especially in Montreal right now. So you're not going to have to worry as much about creating any type of excess sun damage, but you should still always be applying sunscreen, especially for acne people, just to make sure that you don't have any excess scarring afterwards from sun burning around the pimples. So this is a day cream as well as a night cream. Whoops. Then you have your bioacne mask. Your bioacne mask, you can use it locally as well, or you can use it full face. So if I am somebody who has a predisposition to acne and that I kind of have it a little bit everywhere in my face, what I would recommend you do is that once to twice a week, you're going to put it everywhere on your skin after doing your cleansing routine as well as your toner. You can leave it for anywhere from 5 to 15 minutes and then you're going to rinse it off. So this is going to help to regenerate. Again, if you have done your own little extraction at home, which again, I don't recommend you do as much as possible, but it's going to help to just close everything back up and prevent the appearance or the new pimples essentially that could be coming afterwards. So once to twice a week, make sure to avoid your eye contour. You're going to have some oceanic glacial clay in here, so you do get a really nice cooling effect from it, along with the salicylic acid. And the other thing that you can do, so for the moms and dads who are listening mainly for their teenagers, what I would recommend, especially if there's a lot of acne in certain areas, you can use this as an overnight treatment for 1 to 2 weeks maximum. What that means is that every night you would clean your skin, apply your toner, apply your purifying gel, and then on top, in the area, you're going to apply a thin layer of your bioacne mask. Your bioacne mask is going to work, yes, as an overnight. It's going to create a barrier to make sure that there's not no new pimples that are coming out. So really just use it in the areas where you do have an active breakout, and you can do it as a spot treatment overnight as well. That works too. The other advantage is that for people who are maybe a little bit less disciplined as far as their cleansing routine in the morning, and this is going to be important too for even more for anybody who does suffer from acne, cleansing your skin twice a day is going to be really important. So if your skin is white from a mask when you wake up, you're definitely going to be cleansing your skin. You're not going to be going to work or to school with like white spots on your face. So put on a thin layer if you're using it once to twice a week, anywhere from 5 to 15 minutes. A tingle is completely normal. You don't have to worry about it, and then your skin just feels super fresh at the end. So just a reminder, of course, there's going to be the internal factors as well as the external factors. I have like a hair here. I'm so sorry. We have the internal factors as well as the external factors. One of the external factors that people tend to not really think about, I mean, we're thinking about it a little bit more now because we're constantly cleaning our hands, but cleaning your phone is so important, especially if you are somebody who spends a lot of time talking on the phone. You have your phone on your face, and it happens all the time that people come to see me and they're like, I don't know what to do. It's only on one side of my skin. And then we go through their eating habits, lifestyle habits, and they don't seem to really be doing anything wrong, but they always have the breakouts on the same side. And then they realize that it's because they're always talking on the phone on the same side. So the breakout area is really always in here. So clean your phone. Of course, clean your hands before you do any of your at-home skincare routine. Make sure that you're using the appropriate products. Exfoliation is important, but again, don't overdo it. So the point with the Nelly products is that we're trying to prevent, clear, and control any breakouts that could be coming up. So yeah, I think there are a few questions. Let me just get closer. Sophia, thank you for sharing your knowledge. Absolutely. Thanks for tuning in. Thank you, Ginny. All right, I don't think there's any questions today. If you do, as always, please leave them in the comment box. I'm gonna answer over the next 24 hours. And if not, you could always call us and give us your requests for what topics you'd like us to talk about next week. Thanks so much.